Colon cancer, symptoms, diagnosis, and treatment. I knew something was terribly wrong when I saw the bright red blood in the toilet bowl that morning, recalls Michael Rodriguez, a 45-year-old high school teacher from Denver. But like many others, I convinced myself it was just hemorrhoids. This decision would haunt Michael for months to come, as what started as occasional bleeding eventually led to a stage 3 colon cancer diagnosis. According to the American Cancer Society, more than 150,000 Americans will be diagnosed with colorectal cancer this year. And shockingly, cases among adults under 50 have doubled since the 1990s. Even more alarming, African Americans are 20% more likely to develop colorectal cancer and 40% more likely to die from it compared to other groups. Michael's story began with what he thought were simple digestive issues, occasional constipation alternating with diarrhea. I'd wake up with cramping pains, but they'd usually go away after a bowel movement. He explains, between teaching classes and coaching basketball, I didn't have time to worry about it. But the symptoms persisted and new ones emerged. Unexplained fatigue, unintentional weight loss, and that frightening blood in his stool. When Michael finally visited his primary care physician, Dr. James Wilson initially suspected several common conditions. With these symptoms, we had to consider multiple possibilities, Dr. Wilson explains. It could have been inflammatory bowel disease, or IBD, which includes conditions like Crohn's disease or ulcerative colitis. We also considered irritable bowel syndrome, or IBS, which can cause similar symptoms but isn't life-threatening. Celiac disease, which is an immune reaction to gluten, was another possibility. Even bacterial infections like C. difficile or parasitic infections can mimic these symptoms. And of course, hemorrhoids, which are very common, can cause rectal bleeding. Initial tests, including a basic blood panel and stool analysis, came back inconclusive. Michael was prescribed fiber supplements and told to modify his diet. But 3 months later, his symptoms had worsened. I was sleeping 12 hours a day and still feeling exhausted, Michael remembers. I lost 20 pounds without trying, and the bleeding became more frequent. It wasn't until Michael sought a second opinion that he underwent a colonoscopy, the gold standard for colon cancer detection. The procedure revealed a large tumor in his sigmoid colon. Further imaging studies showed the cancer had spread to nearby lymph nodes, making it stage 3. Looking back, there were warning signs we missed, admits Dr. Wilson. The combination of persistent bleeding, unexplained weight loss, and increasing fatigue should have triggered a more aggressive investigation earlier. The delay in diagnosis was partly due to Michael's age. Being under 50, colon cancer wasn't initially high on the list of suspects. Additionally, his initial symptoms mimicked more common, less serious conditions. Michael underwent surgery to remove the tumor, followed by 6 months of chemotherapy. The treatment was grueling, but he had strong support from his family and students. My basketball team visited me after every chemo session. He says with tears in his eyes, they kept me fighting. Today, 2 years after his diagnosis, Michael is cancer-free and has become an advocate for early screening. His case highlights why the American Cancer Society now recommends regular colonoscopy screenings starting at age 45 for average-risk adults, 5 years earlier than previous guidelines. For those watching this video, remember these key prevention steps. Get screened regularly starting at 45 or earlier if you have family history. Maintain a healthy diet rich in fiber and low in processed meats. Exercise regularly. Limit alcohol consumption. And don't smoke. Most importantly, never ignore persistent changes in your bowel habits or unexplained symptoms, regardless of your age. Michael's message is clear. Don't wait. Don't convince yourself it's nothing. Those few months I delayed could have cost me my life. Listen to your body. It might be trying to tell you something important.